Hello, I'm back doing the lymphatic system and the immunity, and it seems like I know this is the fourth time. Of course, I don't do well with technology sometimes. So here we go. So basically, the functions of the lymphatic system are fluid balance, fat absorption, and is for the immune system defense. And sometimes when you draw labs, rare, you'll see when you draw the labs, you'll also get lymph fluid, and the fluid's kind of cloudy, milky, looks like kind of like liquid fat. So, but it's not this huge thing. So defense is the biggest thing you have to know and remember about it. Here's a picture of the lymph system. And you can see it's throughout the whole body. We also talked something about the lymph system when we have done the blood circulatory system. So you have the lymphs, you have the lymphocytes, the vessels, the nodes. Remember, the nodes are when they're infected, you will feel them. They're kind of little hard nodules. Some people have them all the time, but means your lymph things are blocked. Tonsils, we looked at them, especially the palatine, the ones way in the back, the spleen, and the thymus gland. So lymphatic capillaries carry fluids in one direction from tissues to the circulatory system. So the blood moves from the blood capillaries into the tissue spaces. The capillaries are the tiny close-ended vessels. Fluid moves easily into the capillaries in most tissues, and it joins the lymphatic system, kind of like NASCAR with its one-way track when they race. You got your lymphatic vessels continued. They resemble small veins. They have one-way valves. And the big thing is the right lymphatic duct empties all from the upper limb, right head, neck, and chest, and it empties into the right subclavian vein. You need to know that. Whereas the thoracic duct collects from the remaining vessels, and they empty into the left subclavian vein. So that's important to remember. Here's how your lymph vessels are formed. You got your organs, which are your tonsils. You saw your palatine tonsils in the back of your oral cavity. And then way in the back are your adenoids. And usually when they remove your tonsils, they also take your adenoids. And so the surgery is called tonsillectomy and adenoidectomy. So you have the lingual tonsils of the posterior surface of the tongue. So you have 3 sets. But we usually just talk about 2, and we can only usually see 1. And here's another picture. You can see your palatine tonsils. Way at the top in the back is your pharyngeal, and then back of your tongue. That's why you press down on the tongue and say ah and feel like you're gagging. So you have lymph nodes. They're round. Structures vary in size. They're located near the lymphatic vessels. You find them more heavily in the groin, armpit, and the neck. And you felt the neck ones. And they pass through the lymph nodes before entering the blood. Lymph nodes, they move through the whole immune system all over the place. As activated, lymphocytes produce if foreign substances are detected and remove microbes by macrophages. So they remove bacteria through phagocytosis. And here's a little picture. Then you have the spleen, and the size of a clenched fist. It's located in the abdomen. It filters blood, detects and responds to foreign substances, destroys old blood cells, and serves as a blood reservoir. So it's located in the abdomen. The big thing, it filters blood, and it destroys old red blood cells. So that's why often after a traumatic event that in the abdomen from like a car accident or something, they have to remove the spleen because it was so damaged, and you could easily bleed out from the spleen. The spleen has white pulp and red pulp. The white pulp is lymphatic and containing arteries, and the red pulp contains your macrophages and red blood cells that connect to the veins. Here's your spleen. You can see that it's located on the left upper quadrant of your abdomen. Then you have your thymus gland, which is kind of a funky thing if you ask me. And it's a bilobe. It's got 2 lobes. It's located in the mediastinum behind the sternum. In other words, it just looks like it's on top of the heart. And it stops growing at age 1. And by age 60, it has decreased in size. And what it does is produces and matures lymphocytes. Because it starts decreasing in size at age 60, that's why older people are more vulnerable to infections, is because their thymus no longer produces mature lymphocytes. And here you can see it like on top of the heart area. And here kind of is the overview of the lymphatic. So you just kind of need to know the whole system. Immunity is the ability to resist damage from foreign substances. Antibodies and antigens, you've heard of those quite often, especially with COVID-19. They can protect against microbes, toxins, and cancer cells. And that's where a lot of drugs are formed, especially to kill cancer. So a lot of drugs are made with immunity. And you have 2 types, and you've heard of these 2. Innate, which you're born with. Adaptive, which kind of like you get from the outside, like from vaccines. And innate immunity is present at birth. Of course, it goes against any pathogen. And of course, your body has certain barriers that it helps this innate system. And it has the physical barriers, like through your nose, the cilia, your mucous membranes. You have your chemical mediators like your cytokines and your leukotrienes. And you have the inflammatory response. And that's kind of how it works inside the body. And we'll talk a little bit about these in a couple seconds. The physical barriers are your first line of defense. And the biggest one, the huge one, the most extensive one is your skin. So if you have a cut or you have a new tattoo, you're more likely to get it. You have an infection because you have a break in your skin, have a break in the system. Also, surgery is another way to get it. So that's important. Then you have tears, saliva, and urine also wash away pathogens and toxins. So tears, when you have a cold, sometimes you have kind of gunk in your corners of your eyes due to the lacrimal ducts getting rid of some of the bacteria. And a lot of times you see it's yellow. It's because it's getting rid of stuff. Then you have your chemical mediators, and these chemicals are basically from the inflammatory response, and they kill microbes and prevent their entry into cells. Lyosomes are found in tears and saliva, and your mucous membranes prevent entry of microbes. Histamines are some other ones. They're found in the inflammatory by causing vasodilation. A lot of times those are caused from allergic reactions or allergies. Interferons are the big ones that they're working on to kill antiviral, and also they're thinking about doing also cancer tumors. So these protect from against viral infections. And then you have your cells, excuse me. And these cells, we've gone over quite a few of them, so you'll have to know these. And they're produced in the red bone marrow and lymphatic tissues, and they fight foreign substances, and they have phagocytic cells that ingest and destroy foreign substances. For example, neutrophils and macrophages. So here we're going to go review again. Neutrophils first respond to the infection but die quickly. They're kind of the first responders, and if the infection is severe enough, it kind of overwhelms, and your white blood cells start going down really quickly, especially your neutrophils, and the thing is called neutropenia. And neutropenia, you have to do precautions. You can't eat deer, you can't eat raw eggs. Who does? What else? Raw vegetables. People, they can't come in contact with pets or visitors who have colds and stuff like that. Have to be real careful. Can't go Christmas shopping. Then you have the eosinophils. They're produced in the red bone marrow, and they release chemicals to reduce inflammatory. That's when you have again, like allergic reactions, more like what do I want to say? Allergic response to drugs and stuff like that. Basophils in the red bone marrow, they leave blood and enter infected tissue. They also release the histamine, and sometimes they will antihistamines like Benadryl sometimes work, but usually antihistamines work more on the allergic response. Prednisone is another drug that they use. Macrophages initially start as monocytes. They leave the blood and enter tissues, and they can ingest more than the neutrophils kind. Neutrophils are just kind of first line defense. They're the first responders. They work, but they don't do the whole thing. And they protect the lymph and the lymph nodes, the blood and the spleen and the liver. And when they're in a specific body area, like in the liver, it's called Kupffer cells. You have mast cells, and these are more in the skin, the lungs, the GI tract is what they're known for, and urogenital tract. And they release leukotrienes, which are cell mediators. And again, with the natural killer cells, they're looking at cancers, tumor cells, see if they can use your own body to fight off infections, fight off, kill cancer cells and things like that. So they're trying to do synthetic natural killer cells, type of lymphocyte, produced in the red bone marrow. Recognizes classes of cells from tumors or viruses, and they also release chemicals which lyse cells. So you might see more and more of natural killer cells out on the market. And then you have the inflammatory response. You really don't need a whole lot to know about the inflammatory response, except for these three things that it does, and I'm going to talk about them in the next group.